Healthcare consultants available for your decision making. Okay, now what the heck do I do? We've been dumping a whole bunch of information on you. And we've talked all the way through in terms of consultants. Now, what do I do? So, what you need to do now is you need to get yourself educated, which the first step obviously is what you're doing right now by listening to us throw on and on about through this webinar. So, Paul mentioned earlier a wonderful booklet called Medicare and You. I'd advise you, and it's available. It says available soon, but it actually is on the website, on the Medicare website. I would download that booklet and start perusing it yourself just to get a little bit, to kind of reinforce some of the information we've shown you. You want to learn various options that you have, different rules, and again, there are lots of different deadlines and things that John and Paul took you through. The first time, obviously, this can be a little bit daunting, and especially if you have pre-existing conditions, it will eventually limit your flexibility if you change carriers and insurance plans in the rest of your life. So the decisions you make when you're age 64 and 65, some of them will last, for your entire life. So this time of your life is incredibly important to make the decision a good decision based upon what you have, your lived experience, plus, based on family history and, where you think you might, how long you might be living, and other sorts of health issues that you or your family might experience, your parents, etc., going into the future. So there's a decision before the decision. So obviously you'll need to choose Medicare Traditional and Medicare Advantage, but even before you get that, do you want to do this yourself, or do you want to have a consultant assist you during this initial enrollment period, which is 3 months before you turn age 65? So you can do it yourself, or you can get assistance from an expert. If you do it yourself, you'll have to decide, using everything we've been telling you and everything on our website, and Medicare and You, and the avalanche of mail you'll get in your mailbox from different insurance providers, whether you want to go with Medicare and a Medicare supplement or Medicare Advantage, which is right for you. You'll need to research the different plans and insurance providers and decide what is, what you want to do in that first year. And some of those decisions that I said will impact you going forward into future years, some of which you'll be able to change in the future. And remember also, this is just for you or your spouse. On Social Security, there is a Venn diagram, and there's an interconnection between the two. For Medicare, the two Venn diagrams the two circles are disconnected. What you do and what your spouse does are really independent decisions. If you decide to go with a consultant, here is our advice. There are a number of different places you can go. There is an organization, and we'll give you more details on each one of these in a little bit. There's an organization in Michigan called MAP, Michigan Medicare Assistance Program. It is part of it's a state organization within an umbrella called SHIP, which is the State Health Insurance Assistance Programs. Every state has this. In Michigan, it's MAP. It's part of Ageway's Nonprofit Senior Services, which used to be called Area Agency for the Aging, 1B. It's a lot of acronyms and a lot of names, but this is a federal government program that assists people like ourselves in healthcare decisions. It is staffed by volunteers. I mean, there is some professional staff as management, but the people you'll be working with are volunteers like John, Paul, and myself, and they will assist you in this process of making this transition from traditional insurance through your corporation to Medicare. There are also insurance agents, and there are many of them out there who will do the same thing. The difference is that the insurance agents are compensated, not by you, but by the insurance companies. So they will do everything for free for you, but realize, like most insurance brokers out there for home and auto, etc., they are paid by the insurance company based upon the number of clients that they sign up. So just to understand the difference between that Section 1 and Section 2, Section 1 are manned by volunteers, and Section 2 people are insurance agents who are, getting compensated for assisting you. There are 3 of them that we have been working with through NCRO for many years, and there even some of them are on the call right now. They are alphabetically Butler Capital Advisors. There are 2 of them that we work with, 2 people there, Dave Baum and Denise Sikorsky. There's another organization or another broker called Double Health USA, and the gentleman there is Dave Key. And then a third is a woman named Laura Camacho. Butler is in outside of or in Ohio. So outside of the Chrysler plant down in Toledo. Double Health is in Michigan, the consultant, and Laura Camacho, I believe, is in Texas. They all, though, do cover multiple states. So, and I'll show you when you there. I'll give you information on each one of them. But they cover multiple states and also multiple insurance companies. So there's a lot of opportunity by going through them. FCA also has 2 agencies that they work with and you will be getting mailings from them when you are age 64, turning 65. One is Via Benefits. Now, this is a different arm of Via Benefits than I was talking about in the previous presentation. There's Via Benefits and Via Benefits Accounts. Via Benefits Accounts is the department that handles the reimbursement process. Via Benefits, without the accounts words next to it, are insurance brokers. They have different websites and different ways of accessing them, but they're all under the same umbrella of organization. But they are different departments within this larger organization. So even though the Via Benefits words, the first 2 words are the same, one is Via Benefits and one is Via Benefits Accounts. The last option here that we are providing is an organization called AmWins, and they've been around for a number of decades with Chrysler / FCA or Stellantis, and they provide a kind of all-in option way before there was the flexibility of the Medicare Advantage. So in a sense, they're kind of doing what they were set up to do is give you an equivalent of your Chrysler insurance. They're modeled after the Chrysler insurance that you had when you were working in a private market option. They are relatively expensive on the premium basis, but it's purely up to you in terms of which option you choose. So here's the website, and again, I'm going to go flash these slides very quickly, but you'll be able to get this on our website. So here's the 800 number to talk to MAP. If you're not in Michigan, you can go to this SHIP website, which is a national website, and you can enter your state and see which SHIP option or SIP organization is within the 49 other states and District of Columbia, other than the name of MAP for Michigan. There's also an elder care website that you can go to, and you can enter your zip code and get more information on elder care. Here is information about Butler Capital and their website and telephone numbers for both Dave and Denise and what they do. Here's the information on Double Health, which is Dave Key. Here's information from Laura Camacho and her website or her email address and telephone number and her description. Again, all of this, and I'm not giving you time to really read this stuff, but all this information from last year is currently on our website, and any updated information will be on our website over the next week or two. Here's information on Via Benefits, which is Via Benefits, not Via Benefits accounts. If you're an age 64 person, I think there are multiple mailings that you'll be getting from them in particular. I would not, where you might get an avalanche of mailings from lots of different insurance companies and brokers. I'd, in particular, keep these and don't put them in the recycling bin, just because it is sort of designed, because it came from FCA, and that it is, you see even on their website, they have a specific website or web page for FCA in particular. So I would make sure that you at least look at them. You might not end up using them, but at least don't automatically throw those mailings away. You should get like 4, 5, 6 mailings from them over the year that you're turning 64 to 65. And here's information from AmWins. And again, these are customized for Chrysler retirees. So when you get this package, and they I think send only one package, and it's an envelope, a like manila envelope with a whole bunch of forms and information. So definitely keep this and don't throw this away, and take a look at it. And if you don't decide to use it in 2025, I would still put it in your file drawers. So for future reference, if you decide ever in the future that you would want to use this option, it's always available to you. And again, it's been around since 2007. So, many decades, almost over 20 years. So almost 20 years, excuse me. So it's not and they're saying here it's custom designed for Chrysler and not available to the general public. So if you when you get that enrollment kit, look at it, don't throw it away, because it'll be difficult to get access to it, once if you ever do decide in future years to use it. And there's an 800 number you can call to get information on that. Once you've gone through all this and made decisions as to which Medicare option you want, whether traditional, Medicare Advantage, which insurance company, which Medigap, whatever you decide, you have to complete the process. You have to actually enroll in that insurance program. You have to start paying premiums directly or electronically from your bank. You'll get a Medicare card, which no longer has your Social Security number on it, has a unique Medicare number that is for security purposes. They used to have Social Security number was your Medicare number. That no longer has been the case for a number of years now. So you'll have to keep that along with any other insurance company cards you get, because you'll need that for going to your doctors, because they'll want to get that. And when you do make this transition from your traditional insurance to Medicare, you want to give that information to all of your providers, whether it be a doctor, specialist, or hospitals, so that they know where to bill. And also you want to set up yourself on Medicare and also the various insurance companies' websites, because as you get claims, they will be just like your traditional insurance, EOBs, explanation of benefits, and you'll be able to see all of your information as the claims start, being processed from your doctor through the insurance company. And if you have any co-pays or co-insurances, et cetera, you'll want to be able to see that on your on these websites, so in your account, so you'll know what you'll have to pay. So I know that's a drinking from a fire hose and a lot of information, but that's what we've got. Any questions related to the last presentation, or general Q&A on anything that we've been presenting over the last 3+ hours?
Nothing new.
Okay, well, let's give everyone a few minutes here. We were slated to go through 1 o'clock. It's now about 12:40, so we can stay on for certainly a few minutes. If there are any questions that just pop into your mind, please just put them in the chat. And our experts from Paul, John, myself, and also we have some of the consultants online.
I know Laura's online because she sent me some text.
Okay, so again, the questions, we don't want to have specific questions about your situation in particular, because you'll be able to contact the consultants for that, or you can send us questions, John, myself, and Paul, through inscom@ncro.org. But if you have generic questions that would apply to the general population, we're here to answer them. Do consultants charge a fee to individuals they work with? Not to us, but they are paid through the insurance companies.
There's, we've investigated this pretty thoroughly, and it's actually illegal for you to be charged any more by going through one of these consultants than if you were to call the insurance company directly. Mm-hmm. So they're reimbursed by the insurance company, but the cost to you, real world, is zero.
And Paul is absolutely correct. If you decide to do it on your own, and you sign up through a insurance company's website, you will be charged the exact same amount as if you went through, in total, as if you went through a consultant. So, the going through a consultant does not affect you whatsoever, other than purely providing you advice and consultation.
I think Laura had something she wanted to interject.
All right. Yes, she did.
Yeah, I saw some things from Laura, but I wasn't able to read them because I was doing my presentation. So yeah, Dale, if you want to bring Laura in, that's great.
You should be live, Laura.
Laura, are you with us?
She's there. Her microphone is open, but I can't hear her.
Laura, if you want to say something, but your mic's not working, if you type it, quickly into chat, we can put it up on the screen.
Hmm. Huh. I just sent her a text and said she was live.
Isn't technology wonderful? Well,
Her mic's not working.
okay. Ask her on the text whether she is able to text us or not. Either text it the question to you, Paul, or put it in the chat, and Dale can put it up on the screen.
Yeah, Laura, I'm assuming you can hear us.
Okay, there you go. Send up smoke signals. All right, question here. Can you change Medicare Advantage plans after 12 months without going through medical underwriting? Yes, you can. You can only sign up for, and John, correct me if I'm wrong, but you can only change your Medicare Advantage after the window is closed in the enrollment period in the fall, or I think the first 3 months of the calendar you're in. But after that, in the next October, you can change Medicare Advantage plans for the next calendar year, and there is no underwriting. So there is no pre-existing conditions for Medicare Advantage, while there are pre-existing conditions for Medigap plans still.
Can you guys hear me now?
Yes, we can.
Okay, I'm so sorry. I'm technically challenged. So yes, I just wanted to clear up a couple of things. I know that Mr. Kaiser was having a bit of a family emergency, and there was a couple of just things that weren't clarified. The 12 months that he was talking about for open enrollment, that is a trial right that he was referencing. That's only at age 65. For general speaking, your open enrollment starts when your Medicare Part B, as in boy, starts. Then you've got that as soon as that's the 6-month clock that starts ticking down for your open enrollment for a supplement, or you've got the 60 days for an Advantage plan and a Part D. With that said, the two options, Medicare Advantage or Medicare Supplement, it without all the minutia, it can be really easy summarized as each one has pros and cons. So the advantage of Advantage plan is that it gives you all the bells and whistles. Well, a lot of them do. The IRA passing down all of these new caps that are supposed to help the general public. It's going to help the general public, the $2,000 cap on prescriptions and whatnot, but insurance carriers are adjusting for that monetary loss. So I really do believe that when October 1st comes around, we're going to see a big change in all of the perks that Advantage plans offer, because insurance companies are having to adjust for that monetary loss due to the Inflation Reduction Act. But generally speaking, Advantage plans are typically a $0 monthly premium. So that, of course, reduces your monthly cost. And they can offer things that Medicare does not, i.e. dental, vision, hearing, over-the-counter plans, whatnot. The downfall of them is their general instability. You've got to get permission for services. If you don't have a PPO, you've got to get referrals. And just because your doctor is in network now doesn't mean that he's going to stay in network. They can always change. With a supplement plan, the downfall is very apparent. Cost. It's cumbersome and it's costly. You're going to have up to 4 different policies if you want hearing, but it gives you that general stability. Your coverage will never change. You can see any doctor in the nation that accepts Medicare. You'll never need permission for services. You'll never need referrals. And people tend to like that flexibility. But really just depends on what your needs are.
Howard, can you hear me?
We can.
Okay, just a quick comment on, I agree with what Laura's saying, just
Who is, please introduce
hi,
yourself.
this is Dave Key.
Thank
I'm
you.
another consultant, and just to add on what Laura says, this year Medicare Advantage plans they didn't get a cut in the reimbursement, but they had much less than they say they need, and so we're hearing things like some of the major insurance companies are saying, well, we're willing to lose hundreds of thousands of people just because they can't make that. Now there could be some changes with that. Plus, Medicare Advantage plans have to make up for this prescription drug plan. So it's going to be a year of that even if you have insurance, you should look at these, what they call an ANOC, an advanced notice of change, annual notice of change, I'm sorry, to see what your plan's going to look like now. Because I agree with Laura that it could look a lot different, especially the drug plan programs. One other point, just on this question about the 12-month, about can you change Medicare? Can you change your plan? Can you go through medical advantage plans without underwriting? It's for 12 months. It's not 12 months. It's the annual open enrollment period. So you have that open enrollment period. It's going to go from October 15th to December 7th, and that's when you can change. So if you had one late, if you had a new plan in November, you get another chance in December or October for December, and then you can go next year. But it's not 12 months. It's the annual open enrollment.
Got it. I think both of those comments that Laura and Dave said are very important in that there's going to be a lot of change going on over the next couple of years, and we're going to start seeing it as of October, when the new dollar premiums and the new plans are rolled out for 2025, because you've got changes going on in Medicare Part D for 2025 with that $2,000 cap. And that's affecting not only Medicare Part D, but also Medicare Advantage, because Medicare Advantage has Part D in it. So the changes will not be affecting your Medigap policies because there are no drugs within Medigap, but within your Medicare Part D plans and your Medicare Advantage plans, this whole $2,000 cap is a major change, and we're going to have to see how the insurance companies, as Dave was just saying, are going to be reacting to it. Now, that's for 2025. Come 2026, you're going to have these negotiated drug prices for 10 drugs, and then in 27, 28, 29, additional drugs are going to be negotiated by CMS. So that this really makes it so important that when the new information is available and open enrollment period starts at the beginning of October, that you do not go and just do business as usual and just carry over what you did in 2024 into 2025 without doing your due diligence of looking at all the information that, and because what might have been right for you in 2023 and 2022 and 2024 might no longer be the right plan for you, whether it's within Medicare Advantage or traditional Medicare. There's a whole bunch of analysis and due diligence that you're going to have to do as an individual or working with a consultant, so you have the best decision come January 1st, 2025.
Howard?
Yes.
Let's go back to the question that's on the screen.
Okay.
If I'm interpreting that question correctly, it sounds like the person who's asking it thinks that if they start out with a Medigap plan and then go to a Medicare Advantage plan, that then they could go back to Medigap, and that's not true.
No, it is true. What they're talking about, what they're referencing is a trial right. If you start off,
I don't know if they're only talking about the trial.
No, well, there's two trial rights. So if you do start off with the Medicare supplement, you always have a supplement, you are allowed one opportunity to try an Advantage plan.
Right.
If within that first year, when you're trying that Advantage plan, you decide, it's not for me, then you absolutely can go back to the supplement with no underwriting, but it's
But
within
only,
that
but only that first year.
the first 12 months of trying out the Advantage plan. Yes.
After that, you're back to the fact that you were in Medigap once before doesn't count.
Yes, sir. Yes, sir.
I think this question about saying, as Laura is saying, you have two windows. When you turn 65, you have that period of time where you can go back and sign up for Medigap or Medicare supplement without medical underwriting. As Laura's outlined, you have that first year when you can go back if you went into a Medicare Advantage plan, you really didn't like it, then you have a chance to drop out during that trial period. And that's about it. I mean, some other things, much like if you move to another state, there's only a few other reasons when that window is not closed. So if the question is saying, do you want to go through that window when you know it's open, and then later make a decision, because you can always go back to Medicare Advantage if you don't like it or it's so expensive like that, you can always go that way, but you can't go the other way. It's a one-way window, one way, maybe a couple windows, but that's about it. So that's probably a pretty prudent decision if you're not sure.
Yeah, I was lucky with Laura's help. I was actually able to switch Medigap plans because I managed to pass underwriting, and but it gets close. Birthday end of January. When does Chrysler start paying insurance? I would assume they stop the month you turn 65, right?
From my experience, from my experience, at least what I've encountered is that it is the month. I mean, if you're January 31st, you could be losing it January 1st. But then on the other hand, if you're turning 65, it works the other way too, because your Medicare will start January 1st, not January, say 31st, to be eligible for Medicare. So if you're late and you really can't count on that month as leeway, you have to think of it as your Chrysler coverage is going to end on January 1st, from my experience.
Okay.
All that, and again, I don't remember, quite frankly, whether it's whether your insurance stops on the beginning of the month when your birthday's in the middle of the month or not. The best way to resolve that is, here we are in September. Call Benefit Connect. They'll bring up your records, and they'll be able to walk you through exactly what happens month by month going into the future. Rich Brown, you're on the call, and you were texting me on some things with some misstatements that I might have made. If you would like to say something, if there's some corrections you'd like to bring up, Dale, if you could let Rich have the ability to say some things, that would be great.
He just needs to unmute himself.
Rich, do you why don't you unmute and just say if you're cool, or if you want to say something specific and give us some information. Well, I'm not hearing anything. So if there are no more,
he isn't unmuted, Howard.
very good. So if there are no more questions, as Dale has in front of us, thank you for your attention. I think we're all set. As I said, all this information.
I think I was muted externally, but anyhow, I'm back online. I don't have anything else to add. I've been texting a couple observations because the chat's not working for me, and I'm doing fine with everything.
Very good.
Thank
Very
you.
good. That is Rich Brown. He is the chair of the insurance committee for NCRO. So with that, thank you everyone for withstanding the 3.5 hours that we've had here of your attention. All this information, including videos of this presentation, will be on the NCRO website over the next few weeks, along with all of the PowerPoint presentations that we've given you. In addition, as I said earlier, if you have any specific questions, either talk to or contact Benefit Connect via benefits accounts, Merrill Lynch, or if all else fails, you can contact NCRO at INSCOM, INSCOM, Insurance Committee, INSCOM at ncro.org, and it'll come. There you go, Dale. And you might even, there you go, INSCOM. Excellent. So you can email or go to the website or email that email address, and it goes to everyone that is on this call, and we can address your questions as best we know. Realize that INSCOM, we do not have access to your HR information, so we can give you information based upon what you heard in this presentation. But if it's something very specific related to you, your actual situation, and we need records of your pensions or your insurance issues specifically, we have ability to work with the HR department in Auburn Hills and can get more information that way. Let's see. Can someone create a break-even chart for Social Security born on 1960? I would suggest you go to Google that and either go through the Social Security website or Google and see what the Google says about specifics related to where break-evens are. And also, what I suggest is you set up as I said earlier, an appointment with your Social Security office, and they have your specific information. And I think that would be probably it might take a few weeks to schedule that appointment, but I think that is the best way of doing it instead of trying to guess at it and do the calculations yourself. I think the Social Security office would be able to assist you. Well, thank you so much. And this ends our webinar. Thank you, and we'll see you again, if not earlier, through our other webinars that NCR puts on. We will see you again next year. So thank you very much. Have a good afternoon.
Bye, everybody.